Okay. Hi, nice to meet you, Priyanka. All right. Good morning, everyone. Thank you so much for joining such an early session. My name is Priyanka, and I am with the Global Fund Advocates Network, and I will be your moderator for the day. Thank you so much. So today's session is the community advocates charting new paths to fund TB vaccine development. So we all know that there is an urgent need to have a TB vaccine. And that is one of our sure shot ways to be able to end this disease and to be able to save lives. I'm sorry, the cold's getting to me. Um, there are multiple late stage candidates that are in the pipeline with 16 in total in clinical development from phase 1 to phase 3, which is extremely motivating and something to look forward to. But what we need, of course, to be able to make this a reality and to be able to ensure that people actually have access to these vaccines and these vaccines do reach the end mile is, of course, funding. And at the UNHLM, the member states committed to funding of 1.25 billion annually, but that we know is a commitment at this moment. What we need is to hold our governments accountable, is to push our governments to say, you know what, you've committed to this, now it's time for action. And there is a specific way to push our governments, but everybody has a different perspective and a different way to push our governments. And for that, we have this very exciting panel discussion today to sort of understand what is it that community members, that advocates, that people who genuinely care can do to be able to get these vaccines not only just out of the trials, but to the people who need them. So with that, I'm going to introduce my speakers for today. We have Evelyn. Evelyn is a global health advocate with over 10 years in TB advocacy. Since 2015, she has served as the Chief National Coordinator for Stop TB Partnership Kenya. She previously worked with IRV in community preparedness for HIV vaccine trials. She is also the African Director of the Parliamentary TB Caucus, and she is the chair of the board of directors of Waki Health and also the vice chair of the AIDS Healthcare Foundation in the US. Welcome, Evelyn. Next, we have Sean. Sean helps lead the TB vaccine advocacy efforts at IRV, through which they co-lead the TB Vax Arm Coalition and its related global advocacy initiatives, including the TB Vaccine Advocacy Fellowships. They are also a member of the Stop TB Partnership Working Group on New Vaccines core group and founding co-chair of IRV's Diversity, Equity, and Inclusion Committee. Welcome, Sean. Next, we have Rupali. Rupali is an associate professor at the Johns Hopkins Bloomberg School of Public Health in the departments of International Health, Epidemiology, and Health, Behavior, and Society. An expert in vaccine behavior and decision making, including vaccine hesitancy and acceptance. She serves as the Deputy Director of International Vaccine Access Center. Her other research interests include vaccine demand, misinformation, risk communication, and health behavior change. Welcome, Rupali. And last but not the least, we have Frank. Frank is a professor of global health at the University of Amsterdam and the Amsterdam Institute for Global Health and Development, an epidemiologist with over 25 years of TB research. He has worked with and in many high burden countries, both with the international NGO KNCV, Tuberculosis Foundation, and in academia. He led the effort to develop the TB vaccine R&D roadmap commissioned by EDCTP 2021, which outlines the critical steps that need to be taken to accelerate the development of new TB vaccines, as well as the required enabling conditions. Welcome, Frank, and thank you so much for being here with us today. So this is, sure, sure. Would people like to move forward? Yeah? Okay. Yeah. Well, it's great because, all right, everyone nice and comfortable? Great. Fantastic. So my first question, this is a panel discussion. I will start the discussion with some questions from my end, and then we will move on to an audience Q&A. Okay. So my first question is to Evelyn. Evelyn, how can civil society and community advocates hold their countries accountable to do their share in investing and supporting the TB vaccine development?
Good morning once again. Yeah, before we talk about accountability, I would want to underscore the importance of the vaccine, of the TB vaccine. From the experience from COVID, we have learned that all the other interventions, the public health interventions, are good in preventing. We put masks, we isolated, we social distanced, but we did not end COVID. It's until we got a vaccine, an effective, equitable vaccine, that we were able to control COVID. So that will also apply to TB, that we have been doing all the other interventions, but we know the magic bullet is a vaccine. So how do we, as civil society, hold the government accountable? First of all, we know as advocates, you cannot do advocacy around something that you do not understand. So the first thing is to really understand where are we in the vaccine development. She has talked about 16 vaccine candidates. What does that mean? What are the names? What levels are they? We really need to understand so that when you're going in front of the government to talk about support for vaccine 16 candidates, they understand. They may be thinking as a candidate in a school, right? Because the government representatives are not in our fields. So we really have to understand so that they are able to tell them. Number two, we have to be sitting in the right tables. If we are not at the table where decisions are being made, then we lose out. So we need to look out at the country level, at the regional level, at the global level. What are the decision-making tables that we must be there? And just before I move to the issue, I leave the issue of awareness. I just want to ask, maybe by a show of hands, who has looked at the declaration and what it says on commitment on TB vaccines? Oh, thank you so much. Yeah, I can see we have committed people here. Yeah. So we also need to understand what are the gaps. These 16 vaccine candidates, what funding do they require? And this can only be done by, educating ourselves. Yes, I was talking about decision-making tables. Look at globally the, the decision tables that we need to be there. And finally, as advocates, again, we know we cannot fight this war on our own as individuals. We need to do it in partnerships, in collaboration. So let's look around and see which coalitions are doing something about advocacy for accountability and for funding, and join them. At the regional level, for example, we have the GFAN. We all need to be members there because it's in that platform that we do advocacy as a team, and also at the country level. And finally, we need to be in touch with the political leadership at our country level. In my profile, I said I'm the African advisor to I'm the advisor to the African Parliamentary TB Caucus. The TB Caucus is a movement of members of parliament who are very crucial in the decision making around tuberculosis because it's a team that is really committed. We need to be working with such bodies so that we can hold them accountable and also push for more funding for the TB vaccine. We must get a TB vaccine by 2025. I have come up with a new deadline. Thank you. That's my own deadline, right? Yes.
Thank you, Evelyn. So my next question is to Sean. Sean, why is it important to mobilize joint investments in TB vaccine development and delivery from governments, and what would this look like?
Thanks, Priyanka. I'll try and talk loudly. I know this is a bit of an exercise in keeping your attention with the background noise. Um, so I think first and foremost, we have to look at the chronic underfunding in TB R&D as a whole on the commitments that were made in 2018 at the high-level meeting on TB to invest $2 billion annually into TB R&D. By 2021, only 30% of that target had been reached. Now, for TB vaccines, they're proportionally the most underfunded area of the TB R&D response. Only 15% of the TB vaccine R&D target has been reached by 2021. And when you look at the funding landscape, and this is a common thing across, the global health R&D space, but, developers and organizations engaged in TB vaccine development are fighting for discrete funding calls that are, there's no long-term funding guaranteed, and you reach the end of a trial, perhaps you have the data to move forward, and then you spend the next 6 years trying to mobilize the funding needed to progress to the next stage. We've seen that with M72, where they demonstrated positive efficacy signals back in 2018, and then it's almost 2024, and the phase 3 trial still hasn't started, and it took two philanthropies to mobilize $550 million to secure the resources needed to run that trial. And we're talking about developing a product that is going to have massive public good. The savings and millions of lives saved and the billions of dollars in costs averted, are huge. And this is a massive public good, and we need public sector to really step up and put their money and resources on the table to support the development of TB vaccines. And then you can download. And no single country can shoulder this burden alone. No single country should. But we need bold champions to step forward. But I think it's clear from what we've seen in the space so far and across other disease areas, no country is going to step up and provide all the funding we need to move a single candidate forward, let alone the whole pipeline. And so we need to be thinking more holistically about how can we really bring forward innovative funding and resource mobilization partnerships in the space to secure the funding we need. And for this, we need countries to work in unison together, and whether that's through novel funding mechanisms or rather taking advantage of the many, many different funding mechanisms available to mobilize the funding we need. And we need countries to work together and step up urgently, in the next year to make sure we have the vaccines within the next 5 years, this decade. You hear a lot about innovative financing as well, and there's so many different tools that we can leverage here to meet this need. And the recently launched TB Vaccine Accelerator Council, for example, bringing together some of the most high-burden countries, as well as France and the USA as two major global health donors. We have this amazing platform and opportunity that we could use as a first point of action for them to mobilize the funding and make sure that we're able to move forward with the resources that we need. So yeah, thanks.
My next question is to Rupali. Rupali, the widespread and sustained uptake of new vaccines cannot be taken for granted. What are the key research gaps when it comes to defining the specific factors associated with increased demand and uptake of new TB vaccines that need to be addressed to stimulate country-level movement?
Thank you. Excuse me. Thank you so much for that question, and thank you for allowing me to be here. I'm a vaccine person, not a TB person, so just to be very, very upfront about that. So in terms of vaccine introductions, we've seen a huge increase in the number of vaccine introductions just in the last 10 years. So malaria is a great example, RTSS as well as R21. In addition to that, with the advent of the COVID vaccine, we really struggled with regards to how do we deliver a product that is not targeted for a pediatric population at scale. And really what we have found with regards to these vaccine introductions, I study vaccine hesitancy, and across all of these different contexts, to me, there's sort of 4 key drivers of vaccine hesitancy that we should think about when we're thinking about a TB vaccine product. So the first really has to do with risk perception. People have to be, one, aware that they're susceptible to the disease that the vaccine aims to prevent. The second has to do with, in addition to susceptibility, also severity. They have to think that TB is bad enough that they want to do something about it from a preventative perspective. The second really has to do with vaccine safety, and I'm sure many of you are familiar with this. Many of the concerns related to COVID have been very much focused on safety concerns related to adverse events, as well as longer-term adverse events that we have seen. The third has to do really with trust in public institutions. We have seen a huge decline in the trust that people have in public health institutions, including healthcare systems, and that has really affected vaccine acceptance at the pediatric, adolescent, and adult level worldwide. And then the fourth really is misinformation. You know, we live in this world where there is now, unfortunately, a huge amount of misinformation, and specifically vaccine misinformation, that is outpacing evidence-based information on social media. And so while 20 years ago, many parents would say, absolutely, I will get my child the MR vaccine, we're starting to see backsliding, not only across MR, but across all the different types of antigens, including PCV, including HPV, for example, which we're really pushing right now to try to get to at the country level. So I think just with regards to those 4 factors, thinking about how those are specifically playing out in these different contexts is going to be really critical. And I think creating demand for a vaccine now, starting that process now, is going to be critical so that once a product is available, communities are sensitized, and populations are actually open and interested in receiving the vaccine itself.
My next question is to Frank. Frank, there is a critical need for basic research and early clinical research to address the concerns of a too narrow upstream pipeline. How can this work be most effectively supported by funders, and how can advocates help mobilize this support?
Thank you for that question. So I think currently we're all very excited about vaccine candidates going into the late stage trials, close to regulatory approval and then implementation. But I think we have to be very much aware that this is likely going to be an incremental game. So what we can expect, I think, from M72 is probably something that is around the efficacy, so that's the level of protection afforded. That was observed in the earlier trial, which is about 50%, which is great. I mean, we would all be very excited if we have a vaccine that is across all countries and populations and communities has a 50% offers a 50% reduction in tuberculosis. And there's been a lot of modeling done, specifically by Richard and his group, that actually shows that it will have a huge impact. But it's not enough to end tuberculosis. What we really love to have is a vaccine that is as good as a measles vaccine, which is 90 or 95% protective. So that means that you want to make sure that you keep that pipeline, as it is called, healthy. And I think there is a major difficulty with tuberculosis vaccines is that the way they're currently developed is trial and error. Just try something out. Does it work in a laboratory animal? Then try it in another laboratory animal, and hopefully at some point in time it will work in humans. So what I think is really needed is a better understanding of the whole sort of natural, what we call in medicine, natural history, and the immunology underlying why some people get tuberculosis and other people don't, whereas one quarter of the world is infected. So we're only looking at 10% that actually gets tuberculosis. So understanding why this is, I think, is tremendously important. So I think there should also be really attention for that area. And what I think the issue with funding is that this is a completely siloed and scattered landscape. So for example, if you look at it from the perspective of the European Union, so I'm from a European Union member state, and we look a lot at the European funding portfolio. So then you actually see that vaccine trials are very much in EDCTP, because that is the funding mechanisms for trials in Africa. But the real upstream research, the discovery as we call it, that is really under the horizon Europe. And those two don't hardly talk to one another. And the way these calls are structured are completely separate. So I think there is a lot of work to be done there to make sure that they are aligned, and that it's actually in for example Europe, and I think the same will go for the US with the NIH and other funders, that the importance of ongoing discovery is really on the agenda.
Thank you, Frank. I'm going to come back to you, Evelyn. Are there any successful advocacy or awareness campaigns that have effectively pushed countries to take stronger actions for the TB vaccine development? And if you could share some of those.
Thank you. Before I narrow down to any country, I want to say that the entire TB movement has come to embrace the need for a vaccine. And this is demonstrated by the fact that in both political declarations for the 2018 and 2023, the need or the commitment for a vaccine has been there. And for that commitment to be put there, it has come from the consultations that have been done at the community levels for it to see the light of day at that level of the political declaration. For example, when we were doing consultations to inform the current political declaration for 2023, we sat down with different stakeholders in Kenya, and we were asking them, like, what would you want to see in that political declaration? And it was amazing that the first thing that came was the need for a vaccine. That means everybody now is seeing the need for a vaccine. Secondly, even at the country level, people will keep asking, why do we got the BCG vaccine, yet we get infected by TB? That means they're also coming to realize that, there's need for a more effective vaccine. So I will want to look at that level and say, yeah, it's everybody's need, and that everyone globally needs to invest and also advocate for a vaccine, as opposed to looking at an individual country, because it's a need for everybody.
Thank you for that answer. Sean, I'm going to come back to you next. How can advocates join the effort in calling on their governments to invest in TB vaccine R&D?
Yeah, so I think it's already been touched upon, in terms of these global networks, be that GFAN or our own network of the TB vaccine advocacy roadmap, where, we've got stakeholders around the world really engaged and mobilized, in support of TB vaccine R&D. So there's these global networks that we can access, who are already working in this. But we also need increasing efforts at the national level, be that through the Global TB CAB. I've met many of the CAB members here this week who are so eager and motivated to get engaged at the national level in TB vaccine advocacy. And we really need to take advantage of this momentum and this great desire to contribute. We've mentioned the Global TB Caucus as well. We can really take advantage of these national caucuses and parliamentarians around the world and connect them with advocates in their own country, with global advocates as well, and make sure everyone has the capacity and information needed to accurately and effectively engage in TB vaccine advocacy. I think as well, you hear the figure of $1.25 billion, and compared to a lot of things, compared to COVID, we're talking about pennies, money you can find under the couch of a philanthropy or something. But, we need to break that down and think on a more granular level. That when we're approaching countries and we're now trying to get each country to engage in a way that works for them based on their, economic resources, based on their, research infrastructure and, human resource capacity as well. And think about what are the ways that each individual country and each region are able to engage in a way that meets their ability, with their capacity. So this isn't a one-size-fits-all response. And I think the work that Mike Frick and TAG have led with the Fair Share targets is a great way to kind of start breaking down this target and these asks into something that is more manageable and more tangible and feasible at the national level. Making sure that we're not just talking about investments in monetary terms, but also thinking about, those other areas of resourcing, trial site capacity, training, researchers in country, making sure that that at the national level there is more autonomy to engage in early stage development, but all the way through to licensure and in the regulatory sphere. So, and I think that's work that we're now engaging in more, really trying to break down this target. And also thinking about, okay, what are the costs associated to different parts of the vaccine pipeline, to the enabling actions that need to take place as well. And what are the specific costs attached there? So at the national level, when we're approaching countries to invest, we can go forward with solutions saying this is how you can invest based on the financial mechanisms that they could use, and this is where you need to invest and how much you can invest to make sure that every country is contributing in a fair way and in an effective way that will have huge knock-on effects to other areas of their research activities and health system strengthening and vaccine introduction pathways as well.
Thank you for that answer. Okay, so next question to you, Rupali. What do you think may be the key factors fueling vaccine hesitancy? That's a heavy one. And that may impact TB vaccine uptake, and what are the potential solutions that we can come up with?
Yeah, it's a great question, and I think it's hard when you're thinking through a hypothetical vaccine and you're asking someone to think about the drivers that may influence their vaccine decision making. We're doing some of this in this space in maternal vaccination. So the RSV vaccine, I'm sure many of you have heard, fingers crossed, will start to be available in low and middle income settings in the next several years. And so we've been able to, I think, try to identify what are some of the reasons why a pregnant woman would accept or wouldn't accept an RSV vaccine. I think for TB, it's a little bit of a different ball game. I see it a little bit more similar to the malaria product, where people are aware of the disease, people understand the risk perception. There's always going to be questions of safety, as I mentioned, so there will always be questions related to what are exactly the short-term and the long-term effects of the TB vaccine. But the part I think that's hardest, the intractable solution, and we call it a wicked problem in the vaccine space, is this distrust in public institutions. I don't know an easy solution as to how do we build back trust in public health institutions. The COVID experience very much gave us, I think, a very clear, illustrative example of how do you actually shatter trust between a public and their government. I think people felt as though from vaccine allocation, which we will deal with in the TB space, to delivery, to prioritization, to financing, to implementation, to all of it, really caused people to say, I don't really know if I want the COVID vaccine. And most importantly, from the COVID perspective, what we heard from people really was that you told me if I got the vaccine, I wouldn't get COVID. I got COVID anyway. So I think a lot of it is the framing and the messaging of what is the actual benefit going to be of the TB vaccine itself, depending on what candidate comes out, whether that's prevention of infection, prevention of disease, whatever it is. I think it's being very clear in terms of what that messaging looks like. But I think most importantly, I think the larger problem is going to be it's a new product. So, for example, working with the HPV community, this was a huge issue to get the HPV vaccine rolled out because it's a new vaccine. So there's going to be some of this hesitation regardless, but I do feel like, fingers crossed, there are fewer hurdles. At the same time, we're dealing with the public trust issue, and we're also dealing with misinformation in a way that we've never had to deal with before, specifically in the vaccine space, that we will have to counter and think about effective ways. The last point I would say is that during COVID, part of my job was to work and speak with vaccine hesitant people. I spoke to probably 2,000 people over 3 years, trying to better understand what are some of your reasons why you don't want a COVID vaccine. And my takeaway from all of this, the one big lesson learned for me, is that we can't be dismissive of people's concerns. And I think we sometimes come at this from a biomedical paradigm, a hierarchical paradigm, where we say, this is a product, it's good for you. And we dismiss when a person has a question about, well, how do you know there's not a microchip in the vaccine? And many of the providers I worked with felt like they were not equipped from an interpersonal communication perspective to have these kinds of conversations. And so they dismiss concerns, which then leads to, again, more distrust in the healthcare system. And so I think the biggest issue is going to be, how do we improve that interpersonal communication at the community level so that people feel like they're being heard, that you are answering their concerns, and that you are able to provide an answer that makes sense with their worldview, in my opinion.
So my next question is to Frank. Frank, open science is critically important to drive successful and equitable innovation. How can funders not only enable but also enforce it?
Thank you. So what we've seen with COVID-19, with vaccine development, is I think one of the reasons why it was so successful, at least from the biomedical perspective, it was so successful is that it was open science, which actually meant that research groups all over the world were sharing their findings, also negative findings. And I think that is what has been lacking in the TB vaccine development, as in, I think, development of many other products for the disease as well. For example, if a particular candidate, a particular vaccine candidate, usually a combination of an antigen with something else, that is being tried out in animal models, that if it works, it gets into the literature because it's published. Hey, we found something. Now everybody jumps on it, or maybe it takes a while before they get it funded, as we heard. But if there's a negative finding, we don't hear about it. Or very often not, because people think, oh, well, maybe let's go on to the next experiment before we spend time and effort to get it published. And it's very important to share that kind of information, because otherwise we will be in a situation where there is a lot of duplication of efforts. And I think there's a number of efforts ongoing to make that happen. And I think there is another space where that is tremendously important, and it is to use the data and specimens that are being collected of trials that are happening and are about to happen, in order to come up with what we call correlates of protection. So a correlate of protection is something that you can measure, for example, in the blood, and that is a very good proxy for whether the vaccine candidate is effective. And that's tremendously important, because once you have that, you can do with much smaller trials of shorter duration. So you can really accelerate the development. But in order to do that, from these trials, there is only it's sort of very concrete. There's very few samples only. You can only get so much blood out of a vaccine trial participant for very, very good reason. So there's only very little material available. And I don't know who of you were there yesterday in the presentation from the Gates Medical Research Institute, that they've come up with this, I think, wonderful project in which they really, so they took the sort of the repositories, the biosample repositories of the two trials that have shown the signal. So that's the M72 phase 2 trial and that BCG revaccination trial. And they actually said, okay, let's get the best ideas out here and the best labs, and let's together think of how we can best do the discovery for these correlates of protection. So I think that's a wonderful example of open science that is orchestrated, but it's also with the voluntary involvement of a lot of research groups. And I think it's very important that is continued in trials that are now that will be done. So I think and that, I think, is really where funders can play a role, actually by pushing the recipients of the funds to actually do that and say, well, it's all great that you're going to do this, for example, phase 2 trial, and we will give you the 15 million that you need, but the requirement is that you do this, and this, and that you do it together. You do it in a sort of concerted effort with others. So I think these kind of things are really very important. I think funders can play a very active role here, because they can impose a certain level of sharing, even if that's only among the research community for which it's really important.
Thank you. So we have about 10 minutes. Yeah, we have about 10 minutes to the close of the session. Are there any questions from the audience? Richard?
A really lovely session. Thank you very much. And I think we could just about hear you most of the time. Two very quick questions. I would have thought Rupali first On the misinformation side and the trusted information systems, has anybody done a mapping of, because we have, sounds like you're going to nod and say yes, I'd imagine you could do a mapping of the countries where this disinformation, or rather public trust, is low or going down against the TB burden. So if you like, we know where we've got to act and try and turn that around in the next 5 years. That's question number one. And then for Evelyn, for you, how do we get this right? Because you pointed out very early on, we need to know basically what the vaccine is going to be like to engage with communities. But there's also this idea that we need to kind of engage communities over the longer term to get them ready for when the vaccine's going to be ready. So what do we do now, given we don't know how safe it is, we don't know how effective it's going to be? What can we do at the moment?
Richard, to your point, there are several surveys that have been tracking essentially the amount of misinformation and disinformation that's circulating. I think many of you know this is very targeted. There's a small number, for example, of X users that are proportionally responsible for 90% of misinformation that we see, right? Specifically related to vaccines. And so I think what we could do is very much track related to countries, related to high burden, and look at misinformation, and I think have a better sense of where we could predict, perhaps, where there might be more rumors and more what I would consider more coordinated efforts to, really undermine the TB vaccine product. And so I think that's a great idea to sort of compare this side by side, because I think we do have that information.
Thank you. Yeah. I was responding to the question about accountability. And accountability starts with us. And so we should first hold ourselves accountable, the champions who are here, to create awareness among others. And so I'm looking at Mike French. Yeah. We have now the new coalition, the Smart for TB. I think we need to start planning for how we are going to create awareness among communities, among civil society about everything to do with the vaccine. We have talked about 16 candidates. We've talked about the funding gap. We've talking about a commitment of 1.25 billion annually. I mean, we need to package that information in a way that the communities and advocates will understand, so they can be able to engage, the rest of the stakeholders. So yeah, let's hold ourselves accountable to deliver that information in a simpler way to the people who need it. Yeah, so we are holding ourselves accountable to that. Thank you.
Hi there, thank you so much for these presentations. I feel I'm a clinician from Cape Town, and I feel really humbled to be speaking to you. I feel like I've come to the party a bit late because I've spent the past 10 years working so hard to get bedaquiline to patients and getting shorter regimens and things. And now I'm working with children who have bedaquiline-resistant TB. And it just I feel so despondent. And I went to the vaccine session and I heard Mike Finch talk and everybody, and I just feel like this is the only way to go. But from my side, I just, I've been involved in advocacy before, but I just wonder what advice you have for clinicians who are working with people with TB, how they can get involved in advocacy. Talking about funders and governments, it just seems so hard to reach. Like, what does a person on the ground do to say, I want to be involved in this and I want to encourage patients to want this vaccine, because we need to get people to want this vaccine, right? Because I just think this is the only way we're going to end TB. So yeah, any advice you have would be great, and I'm happy to speak to you afterwards if that's...
No, that's a really wonderful question, and I think there are so many engaged, community networks around the world. In South Africa, for example, there's a really robust community advocacy network, and I think as vaccine advocates at the global level, something we've been discussing this week actually is just trying to have a clear map of what are the local organizations in each of these countries that we can direct people to. So as a clinician, for example, you are able to direct people who have TB, who want to, or who have family members affected by TB, who want to get engaged at the grassroots level, so you know where to direct them. Because there are a really robust network of community-led advocacy groups around the world. And then I think from our side, and something that we're increasingly, thinking about and trying to find the best way to do this is also making sure that we're engaging with those community networks and making sure they, and I think Evelyn has spoke about this really beautifully, making sure they have the information and the skills they need and know how to actually engage in national level advocacy. So they know how can they engage with their parliamentarians, with their government, and help push legislative changes or funding changes needed to support vaccine development and then implementation as well. So I think it's work in progress, and it will definitely require us all to be working together here. And I think is something that we hope to, in the short term, have clearer information about where people can go to engage in TB vaccine advocacy, but also increase our efforts to make sure people have the skills to engage in that advocacy. We do TB vaccine advocacy fellowships. They're small cohorts, but of people affected by TB from high burden countries. And I think efforts like this can be replicated by other groups as well. We have lots of materials that could be used here to help share these skills and better engage people at the grassroots level.
Sorry, just saying, as well as a physician in South Africa, what we really need is physicians to get involved in actual TB research as well. So, we've got the M72 trial, which has taken 34 of the clinical trial sites in South Africa, and we would love to have more physicians involved on the vaccine side, not only the drug side. So that's a way that you could really get involved. We've got MTB Vac that will be looking for sites. I mean, before we know it, BioNTech's product will be ready for next phase clinical trials. So, get yourself ready to be a clinical trial site on the vaccine side. We need you.
So we are unfortunately at time. I will thank all of my panelists for these very, very important interventions. And of course, this is just the beginning of a conversation. If you have questions or comments, please feel free to find them after the session and continue the conversation. Thank you very much.